Hello, my name is Dr. Conrad. I'm a prostate cancer surgeon. Let me share with you the story of one of my patients who had erectile dysfunction, who needed penile implant surgery, the problems he had, the solutions we came up with, and what all of that could mean for you. I'm talking here about a patient of mine in his 50s who weighed 300 pounds. This man was at high risk for erectile dysfunction by virtue of being so overweight. When he had his prostatectomy, when he had his prostate removed surgically, he developed erectile dysfunction. This did not come as a surprise. Being overweight, having prostate cancer surgery, diabetes, high blood pressure, and other things are all associated with a high risk of erectile dysfunction. Like other men, my patient tried all kinds of treatments to try to get his erections back. He started with oral medications. Those caused him headaches. They didn't work very well. In fact, they didn't work at all. He tried injections. He tried pumps. None of those worked either. Given the circumstances, his remaining choice was penile implant surgery. What this patient discovered, and this is pretty common, is that his insurance wouldn't cover for his penile implant surgery. This meant that he then had to go out and shop for penile implant surgery on his own, shopping including for how much all of this was going to cost. He approached the local hospital and he asked them that very question. He said, "How much is it going to cost me for penile implant surgery?" The first answer he got back was, "It's going to cost $60,000. To put that into some kind of perspective, we're talking about a 1-hour procedure generally done in an outpatient facility. Staggered by the price, he continued. He asked them a number of other questions. Who's the surgeon going to be? Does the price include the anesthesia? Do I have a choice of implant? And so on. What he got, which is also common, was essentially the equivalent of a deer in a headlight. They had no idea. They knew what the price was going to be, $60,000, but they didn't know who the surgeon was going to be. They didn't know if he had choice of surgeons. They weren't sure if it was going to include the anesthesia. They'd have to get back to him. Frustrated and disappointed, he called me and asked me whether or not I could find some sort of alternative solution for him. I don't do penile implant surgery, and what I told him was, let me see what I can come up with. Let me see if me calling doctors and hospitals where I work will do any better for you than what you discovered on your own. Within a few weeks, we came up with 3 different choices for him. We put together packages that included the facility, the surgeons, the anesthesiologist, the implants, and so on. The packages we came up with ranged in price from $19,000 to $35,000, so markedly less expensive than what it would have been for him where he had gone on his own, and amazingly different in the price. Between $19,000 and $35,000 is a huge difference in price. It's almost 100%. In any event, he chose one of the packages, he had surgery, and then he went on his way. The story I shared with you illustrates a number of the problems that face men with erectile dysfunction. Among those problems, doctors are really busy these days. Erectile dysfunction doesn't seem to be very high on their list of priorities. When you find a doctor who does talk to you about your erectile dysfunction and how to manage it, and how to treat it, in many cases what you'll find is that that doctor actually knows very little about penile implant surgery. This is surprising given the fact that penile implant surgery has been around for over 40 years. So the doctors are busy and they're not well informed. What you'll also find in many cases is that your insurance doesn't cover penile implant surgery. And as if that's not enough, you're dealing with erectile dysfunction, which is generally a very private matter, so you don't really have a lot of choices in terms of where you feel comfortable going to talk about your different treatment options. That is a lot to deal with. Let's talk about what we're doing to solve some of these problems. Surgio is a surgeon-driven surgery market. Our purpose is to simplify access to quality care. When I say we, I'm talking about the surgeons who are involved with us, the anesthesiologists, the facilities, and other people. We believe, like I'm sure you believe, that every patient deserves 3 things. Every patient deserves quality, every patient deserves convenience, and every patient deserves choice. So the question now becomes, how do you go about getting those things? How do you get quality? Well, let's start with that. In surgery, what determines quality more than anything else is who is your surgeon. You want the right surgeon doing the right procedure. Getting at who the right surgeon is takes a lot of work. It takes a lot more work than just going on the internet, for example, or asking your primary care doctor. In our case, it means using a system of peer credentialing. This means that we actually talk with other surgeons who've done the surgery we're talking about with the surgeons who we're considering for Sergio. In other words, we get as close to actually scrubbing with the surgeons as possibly can be. This peer credentialing process relies on the fact that surgeons know quality when they see it. This is not surprising, but I will tell you that this sort of peer credentialing process has actually been studied and had been very well validated with real science. This is probably the best way to get at how to find the right surgeon for your surgery. Surgeon peer credentialing. Having found the quality, having found the right surgeons, what we then seek to do is make things convenient. The first thing we do is package. That way, you don't have to worry about all the things you forgot to ask for. So just like my patient said, look, I need anesthesia, I need facility, I need implant, I need care before and after, all of those things, we know you need those things. It's obvious you need those things. And so because those things are needed, and it's so obviously needed, we package those into every one of our packages. So we're building penile implant packages that include highly qualified peer credentialed surgeons, the operating facility, inflatable or semi-rigid prosthesis, your choice, care before and after surgery, anesthesia, and so on. There's one more thing, and this is pretty unusual. We also package in financial complications protection. So every one of our packages comes with essentially collision insurance, if you want to think of it that way. Up to $25,000 for up to 12 months coverage in the event of complication. So your first protection is having the right surgeons. Your second protection is everything is packaged, no surprises. And the third is a financial product that covers you in the event of an actual complication. Quality first, convenience second. The third thing we do is we build in choices. Why? Because if you live in Nashville, it may not be easy for you to get to Salt Lake City, and that's not a really good choice for you. So we've got packages, we've got choices all throughout the country. We're building more as we go that allow you to pick whatever works best for you. So the idea behind Sergio is to preempt all the sorts of problems I described to you that my patient faced and provide you with simple access to quality, convenience, and choice. I've been doing prostate cancer surgery for over 30 years. I have a reasonably good sense of the issues facing men with erectile dysfunction, doctors who are busy, general ignorance about penile implant surgery, lack of coverage, confusion on the parts of hospital people who don't know what your choices are, who don't know who the anesthesiologist is going to be, and so on. The idea behind what we're doing here is to take all of that knowledge and all the knowledge of all the other surgeons who are working together under Sergio and put that together for your benefit. Sergio can give you simple access to quality, convenience, and choice. My name is Dr. Krongrad. If you're dealing with erectile dysfunction and you think you need penile implant surgery and you're having a hard time gaining access to it, give me a call. I would love to talk with you, and I'd be happy to see what I can do to help you. Thank you very much.